chair recognizes Mr. Swalwell from California.
Thank you, Mr. Chairman, and thank you to our panelists. What I've taken away from this hearing and what we've learned over the past month is we have to fight this aggressively, most importantly, over in the countries involved in West Africa. Two, that we have to be prepared here locally, whether it's the airport screenings that take place or the hospitals that are ready. And also, three, that we have to bust some of the myths out there that is creating, I think, unnecessary hysteria. So I want to first start with what we can do here locally with the airport screenings. And Mr. Wagner, we know that every day about 1.75 million people are in the air in the United States. We have about 100,000 pilots, 95,000 flight attendants who are on the front lines who could be exposed to this. And I think some good questions are rightfully being asked. And so one of my concerns, although we have 5 airports that are now going to have intensified screenings, what would happen if somebody were to fly from, say, Brussels to Dallas-Fort Worth Airport, and then, like many foreign travelers, stuck around in the United States for 2 to 3 weeks and went from Dallas-Fort Worth to, say, San Francisco International Airport, and that's not one of the 5 designated airports. Would that person who perhaps did not present symptoms at DFW but started to present symptoms as they went into San Francisco, is there anything there that would allow us to screen that individual?
Well, Customs and Border Protection is only going to screen them on their initial entry into the United States. So when we see them coming into DFW, we would identify that travel as having originated in one of those 3 areas. We would have provided them the information notice about symptoms to watch out for and where to go and seek health. And the information notice also has a message to the doctor that they can provide. But then we're relying on that person, wherever they travel within the United States, if they start to develop those symptoms, they need to go get the proper medical care and get the medical authorities to make that determination that, is it Ebola or is it the flu or is it something else?
Sure. And Dr. Merlin, as far as our local hospitals, I'm having a conference call with all of our hospital officials on Tuesday, and what are we doing to reach out to them to make sure that they know what to look for if a patient comes in and has been traveling to some of these West African countries and is presenting symptoms?
We've been communicating with hospitals through a variety of mechanisms. We have an established email electronic communication called a health alert network that goes out to thousands of facilities and providers in the country. We've been working with our state and local partners to reach out to facilities and physicians. We have a regular conference call called the COCA call, which is a clinical outreach call, where I believe one of the ones recently on Ebola had about 6,000 participants on it. And we've been working through the medical societies. There were a lot of presentations. This is Infectious Disease Week, and the Infectious Disease Society of America just had its meetings, and there were a lot of presentations on Ebola. And we have a large group in our Emergency Operations Center that regularly now is having outreach calls to either individual hospitals that want questions answered or professional groups that want to have questions answered. We've had conference calls from single facilities
Sure.
to large groups of facilities, trying to help them with their preparations.
And Dr. Merlin, my colleague, Mr. Barber from Arizona, alluded to the CDC budget, and budgets reflect priorities and values. And I think the numbers around the CDC budget over the past few years reflect that prioritizing public health and addressing worldwide health emergencies have not been our top priority when it comes to the numbers. From 2010 to 2014, CDC budget has steadily gone down. From 2012 to 2013, the program level for the CDC was cut by $293 million, which included $13 million in cuts to our efforts to prevent and respond to outbreaks of emerging infectious diseases. Is today's funding level for the CDC adequate to address the worldwide threat and what could happen here in the United States? Would you like more, and if you had more, what would you do with it?
That the response to that I will defer to the CDC director and HHS. I'm not in the position at CDC where I really understand and participate in the full budget formulation.
Has your budget been cut, though, since sequestration?
The budget for my division is about, I just have to, I'll have to get back to you on that. Has not been, there are my budget comes from multiple different sources, and I'd have to get back to you on that.
Thank you, Mr. Chair, and I yield back.